If you've ever been told that you can't take estrogen because you have migraines or hormones cause strokes, I need you to pause because that statement is way too broad. And broad statements are exactly how women get scared out of treatments that may actually help them. So let's clear this up. When we talk about hormone therapy risk, we cannot just say estrogen is dangerous and walk away like we solved medicine or solved a problem. It's really more complex than that, ladies. That's lazy medicine. And it's also in saying that we as women can't make our own decisions. And guess what? We're very capable and can, okay? The real question should be what kind of estrogen? What dose of estrogen? What route of estrogen? How old are you? How far from menopause are you? Do you smoke? Do you have migraines with aura? Do you have clotting disorders, high blood pressure, history of stroke? You get my point, right? This is the conversation. It's not, oh, you had migraine, so you can never have estrogen. That should never be the conversation in medicine because really, it all goes back to risk, benefit, and having these conversations so you, as a woman, can decide what you want. Not fear, not blanket statements, actual risk stratification. Okay, so let's start with the big question. Is natural estrogen safer than synthetic estrogen when it comes to stroke risk? The answer is this. Bioidentical estradiol, especially when used through the skin or patch, gel, or spray, so that's transdermal, may have a different risk profile than oral because it doesn't go through the liver in that same first pass effect. And that matters. Oral estrogen goes through the liver first, and that can increase clotting pattern proteins in some patients. That risk is also very low, but the risk is there, right? It's going through the liver, it's going through the clotting system, so yes, it can. Transdermal estrogen, on the other hand, patches, gels, sprays, tends to have a less impact on those clotting pathways. It's going transdermally. It's not going through that first liver bypass system, and it's going through your skin. So when women say, I'm scared of estrogen because I heard it causes strokes or blood clots, I want you to know, are we talking about oral estrogen? Are you talking about transdermal estradiol? Are you talking about older synthetic from hormone studies? Are you talking about birth control? Are you talking about menopausal hormone doses, right? You can see the nuances. It's in the weeds because these are not the same thing. And this is where the migraine myth gets messy. Migraines with aura is a known stroke risk factor, especially when combined with smoking, uncontrolled blood pressure, high doses of synthetic estrogen that are in birth control pills. But menopause hormone therapy is not the same as birth control. Birth control often uses higher doses. Again, it's synthetic, right? We have to use high doses and they have to use synthetic to suppress ovulation. Menopause hormone therapy is lower doses, used to replace those hormones. It's not synthetic, it's bioidentical. Okay. So if you have a migraine with aura, does that mean estrogen is automatically off the table? No, not necessarily. It means your clinician needs to be thoughtful. And in many cases, if estrogen is considered, transdermal estradiol, the lowest effective dose, may be preferred over oral. Okay. And steadier levels matter because some migraines are triggered with hormonal fluctuations, especially estrogen withdrawal. So, for some women, stabilizing estrogen may actually help hormonally triggered migraines. For others, estrogen may worsen headaches. This is why we do not guess. We track, we individualize, we start low, we monitor. That's how this works. Okay. Now let's talk about the word natural. The word natural sounds comforting, but it's not medical safety guarantee. Okay. Poison ivy is natural. That doesn't mean I want it on my skin, right? What matters more is whether the hormone is bioidentical, how it's delivered, how it's metabolized, and whether it fits your personal risk profile. If you get the hint in the theme here, it's personalization. Bioidentical estradiol means that molecular structure is the same as the estradiol your body makes. That's different from older synthetic or non-bioidentical formulas. But again, bioidentical doesn't mean risk-free. There's literally absolutely nothing in medicine that's risk-free. You can drink too much water and die from it, right? So it means that we are using a form that is more closely matches human physiology. And when we still have to prescribe it, we still have to prescribe that intelligently. So for women with a uterus, estrogen needs to be paired with the progesterone to protect the uterine lining. And there's another place where nuance matters. Micronized progesterone is different from synthetic progestins. So some women tolerate one beautifully and the other one is awful. So the headline isn't HRT is safe for everyone, and it isn't HRT is dangerous for everyone. The truth is, hormone therapy can be incredibly helpful for the right woman at the right time with the right formulation, the right route, and the right monitoring. And it can be inappropriate for some women. Both things are true. So if you're sitting there with hot flashes, insomnia, rage, brain fog, worsening ADHD symptoms, migraines, joint pain, vaginal dryness, please don't let outdated fear be the end of the conversation. Ask better questions. Find a good physician or provider that can help you. Ask, am I a candidate for a transdermal estradiol? Is my blood pressure controlled? Do I have migraines with or without? Do I have a personal history of clotting? Would a gel patch be safer than a pill? What's the lowest dose? That's the level of conversation women deserve. Not your labs are normal, not you're just anxious, not hormones are dangerous, and definitely not welcome to midlife, good luck, and buy a fan. No. Okay, we can do better. So here's the home take. Here's the take home. If you're worried about stroke risk and HRT, the route matters. Transdermal estradiol often viewed very differently than oral because it bypasses that liver metabolism. Migraine history matters, especially migraine with aura, but your personal risk factors matter. Natural's not the full answer. Specific, individualized, science-based prescribing is the answer. So comment below if you have any questions that you're too scared to ask about hormone therapy, and we can help you because women don't need more fear. They need better medicine. Until next time, make sure you hit that subscribe button.